Picture this. You woke up one morning and felt a lump on your neck, and you decided, hey, this looks something dangerous. I need to get this checked out. So you go to a doctor and he writes you a blood test. The results will come back in a week. Over the course of that 1 week, you freak out. You don't know what this means. You go on Google to look into what this could mean, and the big C pops up. And now you think, could it be cancer? What could it mean? My life would be over. What would happen to my kids? What would happen to my life? Would my insurance pay for this? Your mind go out of control. It spirals. Then a week passes by. You accept things. Okay, even if this is the big C, it's going to be fine. I'll manage it. Then the call rings. You get a call from your doctor. He say, hey, your test results are here. Let's meet at my office and discuss what our next steps are. So you go to his office and he says, everything looks fine. You are fine. That lymph is probably swollen because of the previous tooth infection you had. And you just noticed it when you were laying in bed and scratching it. There's nothing to worry about. I'll just do an ultrasound just to be safe. And he does an ultrasound and everything comes fine. And you're like, phew, that is cool. I feel like a new man. I feel like I just got my life back. Or a new woman. That is normal anxiety. It's normal. It's common with everyone. As a matter of fact, it would be weird if you're not freaking out. But what if you never stop spiraling? What if your anxiety does not go away despite medical reassurance? What if all your symptoms go away and you're still worried? What if you don't have any symptoms, but you imagine them, or you hyperfocus on something and you catastrophize? That is illness anxiety disorder, especially if it lasts more than 6 months. Illness anxiety disorder requires treatment. It requires professional management. You can't just shoo it away. You can't just stop worrying about it. You can't just say to somebody who has illness anxiety disorder that, hey, can you just stop worrying about it? There's nothing wrong. It's all right. You're going to be fine. That does not work. And because illness anxiety disorder is a type of anxiety, you have symptoms of anxiety as well, such as high heart rate. Your legs feel like jelly. Your muscles twitch. Your eyes twitch. You get random aches that goes away. You get tummy aches sometimes that goes away. You have digestive issues. And these issues exacerbate your anxiety because you go on Google and you go out of control, spiraling again and again and again and again. And it creates a vicious cycle, which is very difficult to break. It makes illness anxiety disorder one of the most difficult and challenging types of anxieties to fix. But recovery is possible, not just possible, but effective, especially with therapies like CBT and exposure therapy. At DAnxious, we specializes in tools like CBT and ERP. And if you'd like help with this, you can reach out to one of our experts. Schedule a call and they will design a program specifically for you, which you can follow using our app. What causes illness anxiety disorder? Experts say they don't really know, but genetics play a huge role. Past trauma in childhood. Sometimes when you have somebody in your family who suffered through all this, you can develop trauma. And then usually there is a trigger event. Like, for example, you getting diagnosed with something and almost having a scare, a panic. And that trigger event triggers your illness anxiety disorder, snowballing on your past trauma. So that is what illness anxiety disorder is. Treatment is quite simple. You reach out to your therapist and he will design a therapy, but be warned, it takes time. It's usually best to combine your therapy with medications and SSRIs and also non-therapeutic tools like our app, Quick Calm, or the Anxious coaches and mindfulness and meditations. And in the end of the day, if you keep at it, you will get better. It's important to understand that anxiety is not as chronic as many people believe it is. You don't have to manage it. you can heal from it. And that is it for today's video. My name is Wayne Harrell, and I'll see you in the next one.